Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The topic today in Neighborhood Health Watch is total hip replacement and the anterior approach. Is a bad hip getting in the way of you enjoying life? Some of the signs that you may need surgery include hip or groin pain, stiffness, and inflammation. The pain is commonly caused by arthritis. Those problems can sometimes be treated without surgery, but when physical therapy and medication fail, the most common treatment option is a total hip replacement. Dr. Ryan Robertson is here today to get us informed. Dr. Robertson is a joint replacement specialist at Parham Doctors Hospital. Welcome and thank you for joining us for First at 4. Before we get into the specifics, though, of the anterior hip replacement, is there a way that a person can ever avoid having this replacement if they are suffering from those symptoms that we just mentioned?
Yeah. So obviously hip pain is something that most people go through at some point in their life. There's lots of different reasons. It's multifactorial. But eventually if you get diagnosed with one of the forms of arthritis, it really can be disabling and something we try to help you through the process doing conservative measures. A lot of people can get a lot of relief with conservative measures, but when you start having major impact on your daily life and you no longer are enjoying the quality of your life, that's when it's the right time to see a surgeon and to talk to somebody about possibly undergoing a surgery.
Talk about the anterior approach. I'm thinking that that's probably from the front, and what are the benefits?
Yeah. So anterior approach is just one of the multiple approaches to be able to do a hip replacement. All the approaches are very successful. People should always remember that this is a very successful surgery. It's one of the greatest surgeries we have in the United States with the greatest satisfaction, but there are certain benefits that the anterior approach gives to the patients as well as to the surgeons that have made it to where I do that approach.
When you compare it to traditional or conventional surgery before, I mean, what's the benefit specifically to the patient? And does it make your job easier as a surgeon?
So from a patient standpoint, a lot of studies are showing that they're enjoying it more, have a slightly quicker recovery from it, better functional outcomes from it. From a surgeon standpoint, makes my surgery a little bit easier, allows me to use x-ray to make sure that the components are in the right place, recreating the anatomy as much as possible to what the patient wants.
So it's a shorter operation and a shorter recovery time for the patient?
So a shorter recovery time and a little bit better functional status early on, possibly quicker in the surgery side.
Thanks a lot for joining us, Dr. Robertson.
Thank you.